What are the goals of rhinoplasty? The overall goal is to make our patients very happy by giving them the nose that they've always dreamed of. But there's a little bit more to it than that. The first part of it is to create a nose that harmonizes with the rest of the patient's facial features. Even the best looking nose on an individual basis, if it's not matched up to the face type, it's going to stick out in a very negative way. So we want all the aesthetic features to flow. You don't want the tiny little nose on a very large or long face. You also don't want a very long nose on a person with a short face. There are a number of these things that we go through during the consultation. The other part is to have the nose itself have very natural features, and along the same lines, avoid features that look very unnatural or the classic fake appearances that actually scare a lot of the patients, such as the over-scooped ski slope bridge, a tip that's rotated too much, a tip that's too pinched, nostrils that are flared upward. There are a number of these things. I discussed them in a lot more depth, especially on the revision rhinoplasty page. So we want to avoid those and create a nose that looks like it was just formed in nature. You want others to look at the nose and say, wow, this really harmonizes and really fits in aesthetically, and it looks like they were just born with it. The last part is function. The nose is not just the aesthetic centerpiece of the face, it's also a functioning organ. We breathe through our nose. So if you create even the best looking nose, however the patient can't breathe, they're not going to be completely happy. So we really have to take into consideration all of those major aspects in order to make the patient happy with their end results.